Regenerative medicine, a revolutionary approach to healing. Regenerative medicine is an innovative field that focuses on repairing, replacing, or regenerating damaged tissues and organs to restore normal function. This multidisciplinary area combines elements of biology, chemistry, engineering, and medicine to develop new treatments that can transform healthcare. As our understanding of stem cells, tissue engineering, and gene therapy advances, regenerative medicine holds the promise of revolutionizing the way we treat a wide range of conditions, from chronic diseases to traumatic injuries. This video drills into the current state of regenerative medicine, its future prospects, and the potential impact on healthcare. The foundations of regenerative medicine. Regenerative medicine aims to harness the body's natural healing processes to restore function to damaged tissues and organs. The three main pillars of regenerative medicine are stem cell therapy. Stem cells are undifferentiated cells with the potential to develop into various cell types. They can be used to replace damaged cells and tissues. Tissue engineering. This involves creating artificial organs and tissues in the lab by combining cells, scaffolds, and bioactive molecules. Gene therapy. Gene therapy involves modifying or replacing defective genes to treat genetic disorders or enhance the body's ability to repair itself. Current applications and advances. Stem cell therapy. Stem cell therapy has shown great promise in treating various conditions, including orthopedic injuries. Stem cell injections are used to treat conditions like osteoarthritis, tendon injuries, and cartilage damage. Cardiovascular diseases. Researchers are exploring the use of stem cells to repair heart tissue damaged by heart attacks. Neurological disorders. Stem cells are being investigated for their potential to treat neurodegenerative diseases like Parkinson's and Alzheimer's, as well as spinal cord injuries. Diabetes. Stem cell therapy aims to replace damaged insulin-producing cells in the pancreas. Tissue engineering. Tissue engineering has made significant strides, including skin grafts. Engineered skin is used to treat burn victims and patients with chronic wounds. Bladder reconstruction. Tissue-engineered bladders have been successfully implanted in patients with bladder disease. Heart valves. Bioengineered heart valves are being developed as alternatives to mechanical or animal-derived valves. Gene therapy. Gene therapy has advanced rapidly, with notable successes such as inherited retinal diseases. Gene therapy has been used to restore vision in patients with certain genetic eye disorders. Hemophilia. Gene therapy has shown promise in treating hemophilia by introducing functional copies of the defective clotting factor genes. Muscular dystrophy. Research is ongoing to develop gene therapies for Duchenne muscular dystrophy, a severe genetic disorder. Future prospects of regenerative medicine. The future of regenerative medicine is bright, with numerous exciting developments on the horizon. Here are some of the most promising areas. Induced pluripotent stem cells, iPSCs. iPSCs are adult cells that have been reprogrammed to an embryonic-like state, giving them the ability to differentiate into any cell type. This technology has several advantages. Personalized medicine. iPSCs can be derived from a patient's own cells, reducing the risk of immune rejection. Disease modeling. iPSCs can be used to create models of various diseases, allowing researchers to study disease mechanisms and test new treatments. 3D bioprinting. 3D bioprinting involves creating three-dimensional structures using cells and biomaterials. This technology has the potential to revolutionize tissue engineering. Organ transplants. 3D bioprinting could eventually be used to create fully functional organs for transplantation, addressing the shortage of donor organs. Custom implants. Bioprinting allows for the creation of personalized implants tailored to the patient's anatomy. Organoids. Organoids are miniature, simplified versions of organs created in the lab from stem cells. They provide a valuable tool for research and have several potential applications. Drug testing. Organoids can be used to test the efficacy and safety of new drugs in a more accurate and efficient manner than traditional cell cultures. Disease modeling. Organoids allow researchers to study the development and progression of diseases in a controlled environment. CRISPR and gene editing. CRISPR-Cas9 and other gene editing technologies have revolutionized genetic research and hold immense potential for regenerative medicine. Correcting genetic disorders. Gene editing can be used to correct mutations responsible for genetic diseases, potentially providing a permanent cure. Enhancing stem cell therapies. Gene editing can improve the efficiency and safety of stem cell therapies by correcting genetic defects before transplantation. Biomaterials and scaffolds. Advancements in biomaterials and scaffolds are crucial for tissue engineering. Smart biomaterials. These materials can respond to changes in their environment, promoting tissue regeneration and improving integration with the host tissue. Biodegradable scaffolds. Scaffolds that degrade over time can provide temporary support for cells as they form new tissue, eliminating the need for surgical removal. Challenges and ethical considerations. Despite the promise of regenerative medicine, several challenges and ethical considerations must be addressed. Safety and efficacy. Ensuring the safety and efficacy of regenerative therapies is paramount. Tumor formation. Stem cell therapies carry the risk of tumor formation if cells proliferate uncontrollably. Immune rejection. Even with autologous, patient-derived cells, there is a risk of immune rejection or adverse immune responses. Regulatory hurdles. Regulatory frameworks must evolve to keep pace with advancements in regenerative medicine. Approval processes. Streamlining approval processes for regenerative therapies without compromising safety is essential for bringing treatments to patients more quickly. Standardization. Developing standardized protocols for the production and testing of regenerative therapies is crucial for ensuring consistent quality and efficacy. Ethical considerations. Regenerative medicine raises several ethical issues that must be carefully considered. Stem cell sources. The use of embryonic stem cells raises ethical concerns related to the destruction of embryos. Genetic editing. The potential for germline editing, modifying genes in sperm, eggs, or embryos, raises concerns about unintended consequences and the possibility of designer babies. Potential impact on healthcare. The widespread adoption of regenerative medicine could have a profound impact on healthcare. Reducing healthcare costs. Regenerative therapies have the potential to reduce healthcare costs by providing long-term or permanent solutions to chronic diseases and injuries. Chronic disease management. Regenerative therapies could reduce the need for lifelong medication and repeated medical interventions. Fewer surgeries. Tissue engineering and regenerative approaches could reduce the need for invasive surgeries and the associated risks and recovery times. Improving quality of life. Regenerative medicine can significantly improve the quality of life for patients by restoring function and reducing pain. Restoring mobility. Stem cell and tissue engineering therapies can help patients with joint and spinal injuries regain mobility and independence. Pain management. Regenerative approaches can alleviate chronic pain associated with conditions like arthritis and degenerative disc disease. Regenerative medicine can provide new treatment options for conditions that currently have limited or no effective therapies. Neurodegenerative diseases. Stem cell and gene therapies hold promise for treating diseases like Parkinson's and ALS, for which there are currently no cures. Organ failure. Advances in tissue engineering and 3D bioprinting could provide alternatives to organ transplantation, addressing the shortage of donor organs. Real-life success stories. There have already been several success stories in regenerative medicine, demonstrating its potential. Stem cell therapy for spinal cord injury. In 2010, a patient with a spinal cord injury received an experimental stem cell treatment as part of a clinical trial. The patient experienced improved sensation and motor function, offering hope for future treatments. Lab-grown bladders. In 2006, researchers at Wake Forest Institute for Regenerative Medicine successfully implanted lab-grown bladders into 7 patients with bladder disease. The engineered bladders functioned well, providing a proof of concept for tissue-engineered organs. Gene therapy for inherited blindness. In 2017, the FDA approved Luxturna, a gene therapy for a rare inherited form of blindness. Patients treated with Luxturna experienced significant improvements in vision, highlighting the potential of gene therapy for treating genetic disorders. Future directions. The future of regenerative medicine is full of exciting possibilities. Here are some areas to watch. Regenerating complex organs. Researchers are working towards regenerating more complex organs, such as the liver, heart, and lungs. Achieving this goal would revolutionize organ transplantation and provide solutions for patients with organ failure. Personalized regenerative therapies. Advances in personalized medicine and regenerative medicine are converging to create personalized regenerative therapies tailored to individual patients' genetic profiles and specific needs. Combining regenerative medicine with artificial intelligence. Artificial intelligence, AI, can enhance regenerative medicine by optimizing the design of biomaterials, predicting treatment outcomes, and accelerating research and development. Regenerative medicine represents a paradigm shift in healthcare, offering the potential to heal and regenerate damaged tissues and organs. As our understanding of stem cells, tissue engineering, and gene therapy continues to grow, so too will the possibilities for innovative treatments. The future of regenerative medicine promises to bring about transformative changes in the way we approach healthcare, improving outcomes and quality of life for patients worldwide. While challenges and ethical considerations remain, the ongoing advancements in this field offer hope for a new era of medicine where the body's natural healing processes are harnessed to cure disease and restore health. If you received value from this video, please like and subscribe to the channel.